Monarch healthcare reports from the Agency for Healthcare Research and Quality can help you see how the quality and cost of hospitals or the quality of nursing homes in your area compare to one another. Monarch combines information about services provided to Medicare patients as well as information about healthcare services collected by state-level organizations. Being knowledgeable about the quality and cost of healthcare in your area can help you or a family member compare and find the right hospital, nursing home, or doctor to meet your needs. Being informed will also help you ask questions so you can make good healthcare decisions and receive safe, high quality, and affordable care. Even if you don't feel like you have a choice of hospitals or nursing homes, taking a few minutes to learn about the healthcare quality and cost of your nearby hospitals or nursing homes can make a big difference in the decisions that you make that affect your health, the healthcare you receive, and your medical bills. Healthcare quality means getting the right care at the right time in the right way. More specifically, it means that doctors and nurses do three things. They recommend the right care and type of hospital or nursing home that meets your needs, and whether prescribing medicines, conducting tests, or providing procedures, doctors and nurses give you the right care for your condition when you need it. Lastly, they also protect patients from risks like getting infections or other health-related issues. Healthcare cost is the total amount typically charged for certain types of care provided at a hospital or nursing home. Depending on your insurance, you may have to pay some, or in some cases all, of these costs. The quality and cost of care is not the same at every hospital or nursing home. Some hospitals and some nursing homes provide better quality of care compared to others. Some are better overall, and some provide higher quality of care for certain conditions, but not for others. For example, a hospital or nursing home might do a good job of caring for people with heart failure, but a worse job at caring for stroke patients. Just as quality varies from one hospital or nursing home to another, so does cost. Don't assume that higher cost means better care. In fact, facilities that provide high quality care often do so at a lower cost than others. Many times, this is because the facility does things right the first time and prevents causing new healthcare problems for patients. Monarch enables you to compare facilities based on the quality and cost characteristics by browsing hospitals and nursing homes by location and by choosing the health conditions or topics that are most important to you when looking at a facility. Suppose you or a loved one is going to have heart surgery. With Monarch, it's possible to create a healthcare quality report that compares local hospitals on the number of surgeries or procedures they have conducted and the mortality rate for each. To view this information, one only has to go to a Monarch-generated website and select the Compare feature. For our example, we want to look at heart surgeries and procedures along with their results. In short, you can use Monarch and any other relevant information to ask questions and choose a hospital with ratings that are most important to you or your family member. Now let's assume you want to learn about what prior patients felt about their hospital experience. With Monarch, it's possible to compare patients' experiences by reviewing patient satisfaction survey results based on their stay at local hospitals. In order to navigate to the survey results from the current page you are on, click the Hospital tab, followed by the Quality Ratings tab. Under Health Conditions and Topics, we want to select Patient Survey Results. And on the ensuing web page, we want to choose Overall Satisfaction from the Select subtopic. As you can see, facilities receive ratings of below average, average, and better than average for how prior patients rated the hospital and whether they would recommend the hospital to family and friends. Now suppose you and your loved ones have made the difficult decision of putting your mother-in-law in a nursing home. Let's create a nursing home quality report that compares and rates nursing homes based on national averages. To do so, we can click either the Browse button under Nursing Homes or the Nursing Homes tab at the top of the Monarch-generated website. On the ensuing web page, we want to select by location, county, and for our purposes, we want to select an individual county before clicking the Run Report button. After the data has generated, we want to view ratings based on national average. Therefore, we want to select national average in the Compare To drop-down box. After the data has sorted based on national average, you will be able to compare ratings based on the overall quality of care and services the nursing home provides, on how many nurses and physical therapists are available to its residents, and on health inspections that grade how well the nursing home performed in providing a healthy and safe environment. The overall rating in this report is a combination of these three individual ratings. Suppose you and your loved one have learned that you are going to have a baby. Here's an example of a report that compares local hospitals' cost of maternity, sometimes referred to as labor and delivery or childbirth. You can compare the average or mean cost based on how long the new mothers typically stay in hospital to understand which hospitals charge more or less for maternity care. To generate this report from the MONAHRQ-generated website, select the Hospitals tab, followed by Service Use Rates, and under Healthcare Service Use, click Find More Information. On the subsequent web page, you want to select Hospital, Inpatient, Clinical, and under Select Dimension, you want to choose Major Diagnosis Category, followed by the topic you're interested in researching. In this case, we're interested in pregnancy and childbirth. The report that generates will show you the number of discharges, the mean charges in dollars, mean cost in dollars, and mean length of stay in days. Suppose you have recently moved and you are now looking for a local doctor for your family. Here's an example of a physician profile report that will let you search for a doctor and provide you detailed information related to their profession. In order to generate a physician profile report from your MONARCH-generated website, click the Browse button found under Physicians. On the page that opens, we want to refine our results to doctors that are affiliated with the family practice. Therefore, we want to choose by specialty and then family practice. After clicking the Search button, Monarch provides a list of physicians that meet the family practice criterion. By clicking a physician's name, Monarch generates a profile report for the selected doctor that lists the doctor's credentials, primary specialties, addresses, and any other pertinent information relevant to their profession. We all want the best health and health care for ourselves and our families. Using Monarch, you can access reliable information to help make important healthcare decisions. Monarch Healthcare Reports will help you understand what is happening at your local hospitals or nursing homes. It can also help you decide what questions to ask your doctor. And it can help you find the hospital or nursing home that can offer high-quality care at a lower cost to meet your healthcare needs. Remember, it's important to consider the quality and cost when making a decision for you or your family members' healthcare needs. For more information on Monarch and its robust selection of healthcare reports, please visit Monarch's website via the URL above.